Over the past couple of months, we have had to fight COVID-19. This is a disease that we are going to fight for the next couple of months until when we get the vaccine that is going to help us reduce the cases that are on the upsurge in the Republic of Kenya. Today, we are joined on this discussion by one of the most fine people we have around, Ben Andachu, who is going to help us paint a picture of the case we have here in the Republic of Kenya. Thank you very much, Ben Andachu, and welcome to this conversation. How are you?
Fine, thank you.
How is this coronavirus period taking you?
Wow. Very bad.
Okay.
Bad indeed.
Okay. It's bad for everyone, basically. We've seen the government of Kenya through President Uhuru Kenyatta reopen the churches in the Republic of Kenya. In the past, I think the announcement was made 2 weeks ago, and we have now, or we are expecting to see churches and people going to churches. How is the attendance like? And have you been to church?
Basically, no, I've never attended one, but from the news where I live, it has a very low turnout. There, there are no many people attending church services as we used to have before this corona thing.
Uh, by the way, it's expected. Is it that because people are fearful about the rising cases, or what do you think people don't want to go to churches?
I think the main problem is the many churches have not been able to meet the standards given by MOH. That's why so many people are in a dilemma, even though that people have very different beliefs. I think over the past 3 months they have learned to worship in their houses, in their work of place, and I don't think they are finding a better reason to go to churches, comparing to how the situation is. The coronavirus is rising every day. Cases are new. Especially today, we had 960 cases from a total sample of I think 8,000 plus. It's a surging curve.
We've seen previously President Uhuru Kenyatta was supposed to have a meeting with the Council of Governors, I think on Friday, but he postponed that for Monday next week. And we expect President Uhuru Kenyatta also to give directions on whether to close up the economy or to continue to have the economy opened up as earlier promised during his reopening the economy speech. What do you make, or what do you expect during this President Uhuru Kenyatta's speech? And on that, I can add this question. Uh, what do you think? Is President Uhuru Kenyatta not taking matters health seriously?
I think I'll start with the first question, whereby I don't expect Uhuru Kenyatta to go ahead and close the economy again, the sensation of movement, because I think so far the disease is widespread. We can say the places that we are hoping that it won't reach, like maybe countryside, huko mashinani, it has already been there. So there's no need of closing again, sensation of movement. I don't see there's no need, because again they are not giving people food to eat. We hear that there's money everywhere. I think WHO, AMREF, UNICEF, hizo vitu ati wanaleta pesa, but you see now kuna wale wananchi wenyewe hawajapata chakula, like yenye unaweza wafugia, then ndo sasa uwapee chakula to curb this situation of coronavirus. Again now I expect him also to address issue of those in forefront, those who are in the front line to curb the disease. They are health workers. We need more PPEs for them to look for the patient. Again, this story of counties reaching the 300 beds capacity, some counties have not yet reached that level. So the COG chairperson, Paranya, and the president, they are still deliberating. But again, he said that it's upon an individual to take care of himself or herself. So I don't think there's so many things that he will come maybe to say on Monday, Tuesday or Monday, somewhere. So I don't expect so much from him.
Okay, you seem to overlook my last question about is President Uhuru Kenyatta not taking matters seriously.
Oh, of course he's trying. He's trying.
He's trying.
This is a man who is really trying, together with the MOH directives or officials. They are really trying, and every now and then they are giving us numbers, they are cautioning us, they are telling us what to do and what not to do. And they have created awareness. They have brought people who have been affected by this disease, people who have recovered. They have tried to tell those maybe those in urban not to go to countryside, maybe to care for the elderly and those in those who are diabetics, those who have those chronic diseases. Are they chronic diseases or something?
Speaking of Ministry of Health, there have been allegations that we have now corruption at this particular time when we're speaking about coronavirus. We're hearing that money is meant to help us fight this virus is being used wrongly. What do you make out of that as a Kenyan who pay revenue first of all, and a Kenyan who need to be protected by the government?
That's a very weird and that's an inhuman act. If you can steal money that belong to cater for health of a dying individual or maybe a patient who is very sick, that person is equal to a murderer. but again, we can't say that we have stolen our money for now, but we are waiting for the do we call them
the budget allocation, how the money has been used.
we need to see that sheet how
That
they have
breakdown
done.
of how
But for now I can't say that they have stolen.
Oh.
But there's that
there are those
tunawaonea
allegations.
bali sana.
Okay, speaking still on matters money, there have been an uproar coming from the county government saying that we have now what we are calling the new shareable revenue formula, and that has held back the allocation that should be sent to county governments, and now county governments are saying they don't have enough money to fight the coronavirus. From where you see it, do you think that's a standard way of measuring how much a county can do? For example, look at county like Murang'a County compared to Isiolo. It's alleged, because I don't have those statistics, that Isiolo is getting more money than Murang'a County. Given the population, Murang'a County has a higher population compared to Isiolo. Do you think that will hinder or kind of stop these counties from getting to the minimum requirement for fighting coronavirus, speaking to 300 beds?
Sure, but we have a problem with the Kenyan politicians. Before this corona thing came, we had enough time, maybe from 2013, maybe from 2007. Those people who have been being elected, what have they done? Have they maybe we are supposed to be seeing those beds ready, because now there's money allocated to such thing. Maybe from 2013, each county has been allocated some amount,
yes,
whereby they are supposed to be buying maybe those beds and those things per county. But now, okay, maybe you are talking of this revenue sharing formula.
Yeah, that is
the
supposed
one
to be
the one
discussed on
Irugukangata is taking there.
Senate Tuesday.
That bill, I really support it.
Okay, let's not get there.
support
Let's
it.
not get there. Okay. Okay. Let us get to another question, because we've seen the number of coronavirus in the Republic of Kenya rising very steadily. We've seen today cases 960 to the tune of 906, I beg your pardon. And countries like Tanzania, we see that these people still do not believe that COVID-19 is existing. Today we saw that the memorial ceremony for the late President Mukapa, where we saw the stadium full filled to capacity. Do you think that this is a make-up thing that Kenya is soliciting? I think money from outside sources so that maybe for development or something. What do you think?
One thing for sure, corona thing is not a it's not a scam. It's not a scam. Corona is real.
Yeah.
And we are supposed to swallow the bitter herb. First of all, we understand that corona is real.
Okay, it's real. No, it's real. Is it affecting Kenyans only? Because most Kenyans say they know nobody who has
that's
been.
Where I'm coming now. Our neighbors here, I don't know how to term them, but they're just like they're hallucinating. I don't know, but the corona thing is there.
It's real.
I believe they are hiding numbers from us.
So
they are hiding numbers.
All right, now
they're hiding
because
but it is in their country.
we don't have the numbers.
We saw them testing pows and condos, but I know that disease corona is still in their country. They are just shying away from the truth, the real truth.
COVID-19 cases in the Republic of Kenya has brought something new. Home violence. It's on the uprise. What do you think on from your perspective? What do you think?
Ni kubaya sana. Now imagine you have not gone to any job for the past 3 months. There is landlord, there is your upkeep, children are at home. You need so much as a man. Let's maybe start by saying as a man, as the head of the household. Now you have a wife who is not understanding. Understanding.
Let's keep it in English for our viewers.